Welcome to this InLight Authorized Representative Academy module, Talking Compliance. The family of InLight device owners is growing as consumers across the globe continue to experience positive effects by using InLight's polychromatic light therapy. According to the FDA clearance we have, the InLight device has a positive effect on human physiology by increasing circulation and thereby reducing pain. Now the challenge is to learn how to talk about InLight within the context of this FDA clearance, and that's the focus of this particular module. The Food and Drug Administration defines a medical device that requires a 510(k) clearance as an instrument, implement, machine, contrivance, implant, in vitro reagent, or other similar or related article, including a component part or any accessory which is intended to affect the structure or any function of the body of man. So any device that you see on the market that's intended to change human physiology must have an FDA clearance in order to be legally able to market themselves. The InLight product does have an FDA clearance number, K153389. This clearance identifies the InLight products as being safe for the consumer to use, and it assures the consumer that the device is effective in doing what it says it can do, which is to cause the physiologic change that increases circulation and reduces pain. Now, if you're a medical professional, a doctor, a nurse practitioner, a chiropractor, a doctor of osteopathy, a physical therapist, it's within the scope of your medical practice to be able to assess, diagnose, treat, prescribe, and evaluate the outcomes of your interventions. You're able to talk about light therapy for both its on-label and its off-label uses based on the research, based on the growing body of evidence to support your practice. And you may, at this point, want to turn this video off because the rest will be irrelevant for you. On the other hand, for those of you who are non-medical professionals, you're challenged to learn how to talk compliantly about light therapy. And you can learn how to coach people. You can inform people and teach people. You can educate your colleagues, your friends, your family members. And in order to help them understand how the device feels, you can demonstrate the product and you can provide sessions. When somebody asks you, what does PLT do? One of the sure things you can say is, well, research has proven that PLT activates the body chemistry to increase circulation and reduce pain. That's what the FDA says the InLight device can do also. And you can direct people to the PubMed.gov website and ask them to type in the keywords LLLT. Even that single keyword will bring up some 42 to 4,300 research articles, confirming the fact that light therapy and polychromatic light therapy has a growing body of evidence that supports its efficacy. When someone asks you specifically, what can PLT be used for? You could say, the InLight product is useful to reduce pain associated with the inflammation and swelling of muscle strain, sprains, contusions, tears, bruising, fibromyalgia, neuropathy, tendinitis, general joint pain, any kind of pain disorder, whatever the medical name is. You can say that light therapy is as useful to reduce the pain associated with the inflammation and swelling of those disorders. What else can light therapy be used for? Well, the InLight product is useful to reduce pain associated with the inflammation and swelling of chronic wounds, diabetic ulcers, venous stasis ulcers, bed sores, or other types of wounds under the medical professional supervision, or chronic inflammatory conditions like osteoarthritis, rheumatoid arthritis, any kind of bone-involved inflammation or degeneration disease. PLT is useful to reduce the pain associated with those conditions. PLT is also used to reduce the pain and increase circulation associated with post-surgical sites, general headaches or migraines, or structural disorders like scoliosis or vertebral subluxations that cause nerve pain, or blood flow or lymphatic restrictions. You see, the key words here are useful to reduce pain and increase circulation associated with. You got it? Make a note of that. Make a mental note of that. Write that down. This is how you begin talking about light compliantly. PLT can be useful to reduce the pain and increase the circulation associated with various digestive disorders, gastric distresses or discomfort, or inflammatory skin issues like psoriasis, eczema, acne, fungal infections, sunburn, or herpes sores. Remember, it's useful to reduce pain and increase circulation associated with, and then you fill in the blank. So how else can you talk about light therapy? Well, you can share your stories about PLT. How did you come to start using the light? What did you notice? How did it impact you, your family, or maybe one of your friends? Share your stories freely. Discuss the research findings. Like I said, there's over 4,300 for you to pick from. Offer demonstration sessions. You can invite them to an educational event. And at that educational event, you can offer demonstration sessions. You can educate people, inform, consult. Those are the things that you can do and talk about light compliantly. So where can you learn more? Join the Tuesday evening Talk About Light teleconference call. Your upline dealer or distributor can give you that information, or you can find it on the InLight Wellness website. Keep up to date with the current research findings and the frequently asked postings on the talkaboutlight.com website. And you can enroll in an accredited licensing and certification course. Well, I hope this has been informative. I hope you have a better understanding of how important FDA compliance is, and some non-medical professional language tips like to coach, inform, teach, and educate. And certain key phrases, please remember. The key phrase is to say it can help reduce pain and increase circulation associated with. Then you can fill in the medical terms thereafter. And you can always talk about PLT by discussing research, telling stories, offering demonstration sessions, and sponsoring educational events. Thank you for your time, and be well.